Right, so we now delve into the discussion tonight on kidney disease. We have Teresa, who will be telling us a little bit more about her own journey with treatment. We have Dr. Mutori, who's going to tell us a little bit more about the disease, the symptoms, the causes, and the treatment. And Rita as well, who is going to be telling us more about her being a kidney donor. We haven't had a kidney donor on air before, so that's something that we really want to understand. But maybe we can start by, asking you, Dr. Mutori, and at what stage, before we even go into the stages of kidney disease, which is the most common type of kidney disease? I know there's several. Let's look at the Kenyan context, because that's the one that's relatable. Which is the most common type of kidney disease?
Thank you, Janet, for having us here today. We appreciate to discuss about kidney diseases in Kenya, just highlight it and focus mainly on patient perspective, which is the commonest kidney disease in Kenya. So will be the commonest causes of kidney disease.
Exactly.
Usually kidney disease and different stages. So you will find that chronic kidney disease caused by many causes will be the commonest type of disease that you will find.
Yeah.
The commonest cause usually in this part of the world will be either diabetes or hypertension, but not to forget other intrinsic diseases within the kidney itself can cause this chronic kidney disease. And of course we're in sub-Saharan Africa, so infections come quite high.
That's true.
Yeah.
4 million is the number that we're hearing. 4 million Kenyans are affected by kidney disease. That's accurate?
That number is boggling.
It is boggling. That's a large number.
It's derived from much of the data from Western world that about 10 to 13% of their population have chronic kidney disease.
Okay.
If you extrapolate that to the Kenyan population, then you get about 4 million. It's a large number considering our population. So it's true that that number is the one we should be projecting and budgeting for and targeting when we are trying to put in structures to treatment, prevention and care.
Right. I think I know at some point my director is going to bring up some of the graphics around symptoms and treatment that we're going to be looking at. I think we can bring one up right now and sort of delve into it before we hear from the two ladies who are with us in studio tonight. So right now we're looking at some of the symptoms, and there we have them on the screens. So some of the symptoms of kidney disease. And doctor, I know a lot of, initially, some of these can't even be detected until later on. And you'll tell us about that just now. But reduced urine output, fatigue, nausea, poor sleep, poor appetite, unexplained itchiness, shortness of breath, among others. These are some of the symptoms. But someone might look at those symptoms and think, okay, maybe I just have a fever. How do you know it's kidney disease?
Yeah, that's a quagmire in kidney disease, and I'm sure many other chronic diseases. Initially, from the very start, they do not have very clear-cut symptoms. And most of kidney disease, by the time you have symptoms due to this chronic kidney disease, it's quite advanced. At that point, probably there's not much you can do. So what we tend to do is try to maintain it where it is, prevent rapid progression. Rarely do we get regression in most of the situations.
Okay.
So initial symptoms when you have early kidney disease is almost non-existent. When it gets to what we call moderate dysfunction, where your function, if normal is 100, say it's about 30 or 25 to 35%, then you start having some symptoms.
Okay.
However, some illnesses that cause kidney disease will be having symptoms. If it's diabetes, you'll be having diabetic symptoms.
Okay, right. If it's hypertension,
you'll be having that.
All right, we'll go a bit into detail about, but let's talk to Teresa. How long have you had kidney disease?
Thank you, Janet.
Yeah.
I've had renal failure for the last 6 years. That was the first case.
Okay.
And I was detected in 2010 September.
Right.
That's when those symptoms came.
So I was going to ask you, are those some of the symptoms that you were experiencing?
Yeah, like vomiting, nausea, fatigue. Just feel like maybe the way people say they're pregnant, just feel like that. Say, I heard you telling him, maybe you'll think it's a fever. So you just feel them until you go to the doctor. That's when they tell, oh, you're suffering from.
Yeah. So when you went to the doctor, what exactly did they say to you by that time?
You know, I went to so many doctors. By then, my urine output had gone down, so there was no no any diagnosis, no way to diagnose the renal failure until now. I went to Kenyatta. That's where they detected.
Yeah. And how old were you in 2010?
I was 19.
You were that young.
They get sick even at 2 years.
Yeah, and that's what, because they say that kidney disease really affects much older people. And again, we're trying to demystify this and separate myths from facts. So when someone hears 19, you know, they get quite surprised and say, well, that sounds fairly young. So
when they realize they have it, they have to know what is the initial cause.
And what was yours?
That is hypertension.
Hypertension?
Yeah.
Which is still young for 19.
It's not age.
Yeah.
Hypertension can be generic, like we discussed last time, or lifestyle.
Yeah.
So mine was something that was inborn.
Okay.
So by the time they realized it's hypertension, now controlling the BP was another problem. So the damage is already done to the kidney and also to the other parts of the body, like the eyes.
Okay.
Yes.
Right. I'm glad that you're so well informed that you're able to say, look, even, you know, a 2-year-old can have that. I think that's one of the things that people may not really understand.
Yeah, because everybody will look at you in the hospital, why are you so young and sick and hypertensive? No, it's not about age.
Yeah.
Maybe age can affect hypertension, but still you can still get some at any age.
Okay, a little later I'll ask you a little bit more about your treatment journey.
All right.
Before we come to you, Rita, again, we also understand from some of the research we've done that especially the black population and Asian population are more prone to kidney disease. Is this true?
Oh, yes. The black people apparently prone to many problems. One of them is kidney diseases.
And this is not just African Americans, this is black people across the board.
People say the black American is different from the black African who live in Africa. It's another story. But for her case, teenagers between 15 years and 25 years can have kidney disease. Often the cause is from primary kidney diseases. We call them glomerulonephritis. So if they come early, you do not detect them, they eventually present as hypertension. At that time, the hypertension is not because it was really hypertension, because that the kidney is not controlling your blood pressure the way it's meant to do that, and therefore it's dysfunctional. Then you will diagnose hypertension. So what we usually call that is that you have chronic kidney disease due to a misdiagnosis. You would not get to know what exactly is. But don't forget that if you have got a very strong family history of hypertension and you don't control it early, so also that possibility. And
I want to come back to that later when you say you don't control it early. I think that's something that I want to pick up on. But let me move to Rita now. And Rita, you're a kidney donor.
Yeah.
Tell us a little bit more about that story.
So yeah, I donated a kidney to my dad last year in July. He had his kidneys had failed. He'd done dialysis for a bit of time, and then they started working again. But then with time, because he has diabetes, just as Dr. Ria said, it became worse. So by April last year, the only option for him was to do a transplant. And for me, I always tell people it wasn't. I didn't even think twice about it when he said he needed the kidneys. So we started the journey. A lot of tests had to be done on myself and on him, just to make sure that we are compatible. And then on July 7th, we went in, we did the surgery, and it was successful. He's doing very well.
I mean, that's amazing that you would do that.
Yeah.
How common do we have that in Kenya? I think this is now when we're almost kind of going towards some of the treatments, I would say. And I know a huge issue is dialysis, the access to treatment. So you've mentioned that it's because his kidneys failed again that you had to become a donor. Tell us about other times that someone then becomes a kidney donor. Is it do some people do it off the bat immediately without going through the dialysis, or is it when all else has failed that then someone needs the kidney donated?
Thank you again. When you're treating organ failure, this time we're discussing about the kidney, you replace the function of that organ. It's essential for your survival. So that means that we replace kidney function. It can be replaced artificially using the machines, the dialysis machines, or by someone donating to you a kidney. Current research is trying to come up with kidneys you can carry on your back, tiny ones, walk around with them, and they continue working, but we are decades away from there.
Yeah.
So for now, the best treatment is a donation. In this part of the world, people are donating from their relatives, and there are very good reasons why we insist that it continues being like that. Elsewhere, people can donate from non-related donors, so to speak, or from organs harvested from people who have passed away for one reason or another with good organs. For example, you went a Saturday evening, enjoyed yourself, went home, unluckily got an accident, you get to the hospital when the organs are in good state. Some countries will harvest those organs to help other people.
Why did you say in this part of the world you prefer that relatives do it and not the way it's done abroad?
There's a lot of discussion on that, Janet. You can imagine you can come and buy an organ from me and say what, I can sort out all your bills for the rest of your life. Just give me one kidney, I stop going for dialysis. So there's a lot of discussion, but...
Sorry, say that again?
They're called the murder. I can kill you to get another.
That's true. Okay.
I actually remember for me, before we did the surgery, we had to sign a consent. We had to get lawyers for me to say that my dad has not coerced me to, to give him the kidneys. So,
So just to avoid any drama in the future.
So he's not giving me any money. I'm doing it out of my own will.
Okay. Did you have to undergo any treatment after that yourself?
No, because I was physically fit and the wound healed very well. So I've not had any complications, like I need to take medicine. No. Everything went successful.
That's why she passed the quest, the thing about being a donor. You have to be physically fit.
Okay.
Okay.
Let's come back to that. I want to bring up a diagram that actually shows, maybe you can take us through what happens when there's a kidney transplant that's done, and there we have it. Could you very quickly take us through what happens? I know Rita has talked about the fact that she did it for her father, but what exactly happens? If you could just very quickly tell us, Doctor.
Thank you again. Surgical procedure, briefly. You get your kidneys, those two kidneys, that they look a little darkish. I'm not color blind, I hope. They're not working, so you get a relative getting this kidney on the left side, working very well. It is removed from you surgically and then implanted in your, most times it's the right lower abdomen, call it right iliac fossa, and it's fitted into the blood vessels and it works perfectly well. Most of the time we don't remove the native kidneys, so to speak, unless there's a good reason why you can do that. So like his dad now, he has got 3 kidneys. And they're working. No. The only one that is working properly is the one that is donated. So
up to how many can you implant? Because like now, how many? I'll do another transplant.
How many times can you get a kidney from a donor or from another source?
How many can a recipient?
You can have, supposing you, for example, a young person at 10 years. If we estimate that you can live with your kidney for about 5 years, that's good time. We can ask you to get a donation. After 5 years, if it fails for one reason or another, you can always look for another one. After 5 years, if it fails, you can. But usually, they stay anywhere between 10 and 15, and you can have a kidney going on for 30 years. So if you are 50 years, you can actually have one taking you to 80 years, and you can get another one then take you to 100 years. So if you are 25, you can push on to 50.
So but you can't stay with the same kidney for the rest of your life. It sounds like you're saying at some point
it has to fail.
You need to get a replacement.
Yeah, that's true. Reality of life. Even our lives have a point at which they have to give on. But why these ones usually don't last long is, one, you're not careful with your medication, you're not careful with your follow-up, and then the body is probably fighting it very hard. And sometimes you're too careful, all that happens, but it still fails. Usually there are some people who can live with it 30 years, 40 years without any problems at all. Our hope when we are working up a donor like his dad is that we project that at least kidney should give him good service for at least 5 years, or he should be able to survive. So if you are you have multiple illnesses and your projected survival of probably less than 5 years, you're probably not a very good candidate for kidney from another donor.
Can I ask you, are you, and maybe you've answered this in passing, are you, for example, a good candidate?
For another transplant?
Yes.
I'm not
That
sure.
one is for us.
Since now this one lasted for 4 years.
Because she's self-aware, she's probably, I don't know, I thought maybe you've done the consultation and no, you don't know right now.
I'm not quite sure because of the hypertension.
Right.
It can't be hypertension. Hypertension is going to be there. So second donation, second transplant is usually a little difficult logistically and attending to do so. You have to be very, very careful. First of all, we have to ascertain that, you know what, you are a very careful person. This kidney you got initially, you took care of it, but for whatever reason, despite all that, it failed. Then you say, you know what, let's look for another relative to donate. Imagine you're giving your kidney and within 2 years it's gone. That's double loss. We try to avoid that. But you can, yes, she's young, she can get another kidney lasting for 20 years. Again, she can get another one. So it's not unusual to find in some places people surviving on their fourth kidney.
Okay.
Yeah,
all right.
It does happen. So I think you should be able to work it up and towards another transplant.
So what we should tell people, let people know that it is not a guarantee that when you do a transplant it's going to last forever.
Exactly. Yeah, because I think that's the misconception people would have. You have it and you're saying...
Maybe when they accept, most patients will know what happens. Because most people are refusing to do transplants because why waste a kidney for 5 years? Like, I'm sure she's shocked. Maybe she's wondering, oh, 5 years. But it's good. You have said you're done.
Exactly. Well, okay, we'll come back. We'll pick up on that. We have to take a short break. I don't know if we have any tweets right now, but if not, we'll come back with them after the break. Or we have some tweets. Let's read them before we go into a break. And then continue with some after this. Bring them up right now. Let's see what some of you are saying on Twitter. We have at Mbasa_Grace. Please ask Daktari if traces of blood in urine is an indicator of kidney malfunction. Maybe you can take note of these questions, Daktari. Then we have Junior the Biggie, Insightful Talk. Kindly ask, can genetics also be a cause? I think that's already been answered, I believe. Steve Karumbi says, what's the time span of kidney disease before manifestation? Do you want to quickly answer some of those before we take a break?
That's true. First thing, can blood in urine be an indicator of kidney disease? Often it is. Sometimes it's just not kidney. Remember, the urine comes from the kidneys, travels through the pipes, way down out. So if you have any problem along those pipes, you can still spill blood. So when we take that blood to the laboratory, we look and see whether those cells are actually coming from way up the kidney or they're coming along from the tracts. So it can indicate kidney disease, and if you have seen it, please go for checkup.
Okay.
Genetics, we said that you can have kidney disease and transmit it to your offspring. The commonest one that we see in this country is autosomal dominant polycystic kidney disease. I'm sure it's fairly common, and we have many patients on treatment for that, and we usually ask their relatives to do screening or around. We have 10 children, there's that family, and one of them has it, and we ask all of you to screen.
To be screened.
And that question was the last tweet.
The last tweet.
I can't remember.
I don't know if we can bring that up. I believe it was about the time span.
Oh, correct.
Yeah.
How quickly can kidney disease progress? That's the question. If you get it today, how quickly can it progress? First, it has to move into chronic state, and then you have to know what caused it. Can it be reversed? Question we are asked often, when you get this kidney disease, when it's acute, there's a state when you call acute and you recover. Can you recover completely? People now think probably not. So the best thing to do, if you have had kidney problem and you have been treated and you have been declared well, you should be worried and be going to your doctor almost at least once a year to do a follow-up and check-up. That's extremely important.
Okay, we'll check that with trees. Is that something that you still do, and just go for the checkup just to ensure that everything is coming along well, or how does it work for you?
Yes, for me now, because I'm a post-transplant, I have to do it regularly. But what he says is, if you ever had something to do with the kidney, make sure you had a follow-up. You have a follow-up now and then, so that they can prevent the chronic from coming in.
Okay, fine. We'll come back and talk especially about treatment, which is a huge issue in the country. Remember to keep your tweets and texts coming in. We'll be back after this break. We continue now with our discussion on kidney disease and treatment, and this time we want to focus a little bit more on treatment, particularly around the issue of dialysis. And I say issue because of how few people have access to these treatment centers and even the cost of treatment as well. Maybe you can hear a little bit from Teresa, your own experience with dialysis and treatment, and what some of the issues as a patient you feel in the country.
Okay, thank you. So when they diagnosed me with renal failure, that's when they put me on the machines. Now I think everyone knows the dialysis machine. So I've been I dialyzed for 4 years. Then my doctor told me, no, you can do a transplant, you're still young. That's when we did a donor search, and my sister donated the first kidney until early last year in February, when now the kidney failed again, the donated kidney. I really have no idea why. Maybe my doctor says it's because of drugs, but now
the medication you were taking.
The medication, because medication now becomes lifetime. After post-transplant medication is lifetime, and that's another very difficult issue. I mean, a challenge to patients, because I think very few people afford those drugs, and there are very many. So now I'm on dialysis again. If you check here, I have an access for dialysis, where it's very tormenting.
Yeah.
Yeah, it's not dialysis for me. Is very tormenting, and I'm sure when people hear about dialysis, when they see those machines, because something physical, you just fear, and that's why most people die.
Yeah, for you, is it challenging and difficult because it's, so to speak, it's brutal it's expensive, and also
very expensive, and again that torment. So for me, I am very sure, and for many other patients, the cost as per now.
So you're almost one of the lucky ones, one might say, that you're able to access dialysis, because doctor, from what I've read, and you can correct me if I'm wrong, out of the 4 million or so Kenyans who have kidney disease, only what, 2,000 have access to dialysis? And again, I stand to be corrected.
Thank you again, Janet. It's true that dialysis is expensive. It's true that most economies are not able to provide everyone with dialysis. For example, in a population of 40 million, it's estimated that the people who will require dialysis about 0.1%. That translates to about 40,000 people who require dialysis. But the facilities we have now can only accommodate about 1,800. Initially, a couple of years ago, it was less than 1,000. So there is some improvement, and the government should be commended, because it has stepped up dialysis, so to speak. It's not the only treatment for kidney disease, but at least it's a start.
Yeah.
And in terms of cost,
yes, what is the cost?
The government is through the medical insurance, National Hospital Insurance Fund, is providing almost complete in terms of cost for dialysis, which different centers can use to treat the patients.
Okay.
Yeah. So
and there's how many centers that offer dialysis or have dialysis machines in the country, roughly?
Well, we expect, as per the government program, that every county referral hospital
should have, but do they have?
No, they
no, they don't.
Most county level 5 don't have. Most of them.
I can't count for you the ones that I know that have.
I only know in Murang'a. In my county there is none. We all flood in Kenyatta.
Rita, did you have the same experience with your dad? Was it the same? The fact that there just isn't enough to manage the number of people who need it?
Yes. He had to, I think for us who were lucky, he was getting his dialysis in Aga Khan. But you know, I know other people who you have to wake up so early to go to Kenyatta because there's a queue. There's such a long queue. So there is shortage for sure. There is a lot of shortage.
People die in the queue.
Yeah.
Wow.
At Kenyatta. Because sometimes the plants in Kenyatta go off. The water plants, the water, it's just bad.
Yeah. But you're saying there's been an improvement, but from what I'm hearing from the two of you, just a lot more needs to be done. A lot more needs to be done to save more lives.
To be done.
Okay. Roughly how much is the treatment for dialysis?
It ranges in Kenyatta for now within NHIF is 2,500. That's better. In
2,500 per...
Yes, but with the queue.
Per session or per what? Per session.
Yes,
Okay.
it's twice a week or thrice if you can afford. But since now you cannot just queue there and wait for death, sometimes you have to rush to other hospitals which range from 7,500 to 9,000.
Okay, wow.
But that's why I'm saying that the government is actually coming up and really subsidizing the treatment.
Okay, so that it's accessible to more people.
Janet, can the president do something? Can it be free? Because dialysis is more than AIDS. To me, sorry to use that, but dialysis and any other disease that comes with renal failure is more than AIDS. I can assure you that.
Yeah, of course, there's like the doctor is saying, they're trying to do something, and I think he hears the appeal quite often. But what I want to do is very, very, very quickly. There's a lot of questions coming in. I know this is a discussion that needs part 2, 3, 4. But if I can just take some questions from the public, and if we can try and answer them very quickly. Someone here is saying, my dad is 56, diabetic, hypertensive, and has early stage renal disease. He's on dialysis for a year now. What are the chances that he can benefit from a transplant?
Transplant is the best treatment. It's not early disease, it's a late disease. That's why he's on dialysis.
Okay. Then we have Anna from Mombasa saying, can a pregnant woman carry her pregnancy to full term if she has kidney disease?
Yes.
Yes, she can.
We have to qualify that early kidney disease, when you're on dialysis, after transplant, so those are different scenarios that are judged accordingly.
And then we have...
pregnant sometimes can worsen kidney disease. So
pregnancy can worsen kidney disease.
So if you're intending to get pregnant and you have, for example, early kidney disease, stage 1, 2, 3, you should seek opinion of your physician.
Nancy says, I'm diabetic, I have high blood pressure, I've had that for 18 years, I'm now 47. Is it possible for me to have a transplant?
You can't have a transplant just because you've been diabetic and hypertensive. You must have end-stage kidney disease.
Okay. Right. There's quite a few others, I think, also on Twitter as well that we'll try and take a look at. But then, even as I try and search for some of those tweets, I understand that World Kidney Day is in March. Tell us a little bit about what people can expect this year and about the free screenings that people need to kind of look out for as well.
Thank you again. World Kidney Day this year is very special. Why am I saying it's special? Because it's focusing kidney diseases in children. Most of us tend to forget that kidney diseases affect children. They do. And if you have a child who has kidney disease, you will understand that it's a challenging time. It's a lot of commitments. So this year, as we usually do, every second Thursday of March, we go to screen Kenyans at Wool Park, but we usually do a total screening for all week. We call it World Kidney Week. So Monday, Tuesday, Wednesday we screen. Like this year we're going to do screening in Kawangware, if I remember very well. We'll be positioning screening in different malls, in Galleria, in Junction.
This is from what date?
This is, that will be around about 8, 9, and 10.
Okay, that's important for people to know.
7, 8, and 9 will be screening in those malls. 10th will be on a Thursday, we'll be at Uhuru Park screening and getting some testimonies. That's important to spread the gospel that kidney disease is common, preventable, and treatable. And everyone should actually go to their doctors if they don't get a chance to come at that time and ask them what the state of my kidneys, doctor.
All right.
Often they will be told.
All right, a few more tweets before we wind up, a few more questions I think on Twitter. I'm a kidney donor and I'm glad I saved a life. This is my 5th month and my life is normal like before. Okay, well done. That's a comment. These are more comments than questions. At Lisaka_Brown says, the burden of managing kidney disease is exacerbated by a collapsed healthcare system. I think we've touched on that a few minutes ago. Fred Matraka, of course, one of our own at Royal Media. Thank you to the 2 brave women on Monday's special. That's Rita and Teresa. And then very educative segment. Many thanks for that. I think we have one more. Kidney donor is the unsung hero. We should encourage more donors. Moral of the story, I think, is encourage people. Very quickly before we go and we hear from closing comments, how do we then take care of our kidneys? How would you urge Kenyans to take care of their kidneys?
That's very important. Prevention is better than cure all the time. So you start taking care of your kidney right from the beginning at whatever point. And you ensure you eat well, you exercise, you live prudently, then all will go well. But all the time, especially if you are more than 20 years old, you should at least go to your doctor once a year to check your kidney function. It is easily checked. If you can't do that, and since we do World Kidney Day once a year, you can also come there. We can screen you. Blood pressure, blood sugar, weight control are the things that we focus. And if you take care of those, then your kidney will serve you for long.
Okay. All right. Closing words, Rita, and like we said, having a donor here is, we haven't had that before. We haven't heard a lot about, and just from talking to the three of you, even off camera, is the sense that it's not as common. People, I think, have a lot of, they're apprehensive about being donors. What would you want to say to them?
If you have the opportunity, please, you know, donate. I'm living a normal life. My life, I mean, there's no difference. And I gave my dad life. That, for me, is the best thing that I could do for him. So if you have the opportunity, it doesn't have to be a relative. If you know a friend, if you know somebody, and you're healthy, you've done the test, please go and do it.
Okay.
Yeah.
All right. Thank you so much for that. For you, I know this is something you're passionate about. What would you want to tell someone right now who's going through what you're going through at the moment, someone who's watching?
Be courageous, just be strong, learn to pray. God does miracles, even when the doctors say whatever they say. I know God does miracles. I also want to thank all the donors. It's a good job, and I also want to appeal to my siblings. Please give me another one.
Your actual siblings, you're appealing to them?
Yes.
Okay. Have you not?
They feel good when they tell. Maybe I tell them here.
Yeah.
I have told them. I know they know. And they're all rushing to donate.
Okay.
I hope it will
work out well
match,
for you,
and it will go for another 10 years, not 5.
Okay.
I also want to thank everybody who supports me in whatever way.
All right. All the best to you.
And
as you wait.
About medication, let them subsidize the cost, because most of the kidneys which fail again are because of the drugs.
Because at some point they can't afford to take as frequently as they should, and then
it becomes expensive pre and post.
Okay.
So you feel like you have no future.
All right.
But for me, people have been encouraging me, and not helping,
encouraging.
Encouraging.
But thank you for that
and
appeal.
To my dad, he has really tried to save my life, especially when my mom died.
Okay.
Yeah.
All right. Wish you all the best.
Thank you.
Going ahead.
Thank you.
Okay. I think that's all the time we have. I think you've already talked about the fact that everyone needs to get treatment. Thank you to the three of you for coming, for sharing your stories, for sharing your advice. I think there's a lot more ground we would have loved to cover, but that's all the time we have for now. So obviously living a healthy lifestyle, I think we've said that so much on this show. It's so crucial, and we'll continue to say that and show the results as to why you should do so. We need to take a short break. On Monday's special, we'll be right back.